Cédric Brucklandé is the head of the scientific and medical programs for SIDAction. Thank you very much indeed for joining us on France 24 today. Now, globally speaking, the fight against AIDS had been making good progress over the last 20 years or so. Have those efforts been set back substantially by the coronavirus pandemic?
Absolutely. Those efforts have been set back tremendously by the coronavirus pandemic, mainly because there's been a lot of confinement measures in terms of restricting people's movement to be able to fight against the coronavirus infection, which has limited people's access to health and access to any diagnostics. So we do have an effect in terms of people knowing their status and hence being treated accordingly to be able to curb the infection rate.
Now, a little over a year and a half ago, we didn't even know what the coronavirus was or COVID-19 was. And here we are with several vaccines on the table. As we can see, countries are fighting over them right now. When you see the world scientific community and all the world's resources come together to come up with a solution to that problem, is that inspirational, something that can be used in the fight against HIV and AIDS?
I think it's actually been the other way around. It's really the movement and the inspirational work of collaborative research in terms of researchers, the industrial sector, and also the regulatory sectors of the society that have been working throughout the fight against AIDS for several decades. And that has been exemplary and used actually to apply it to the COVID situation. And those resources are not only limited in terms of mobilization of the different sectors, but also in terms of profiting from the knowledge that has been acquired to the HIV research.
So 3 days of focus from SIDAction. As we see, we're wearing your symbol today in the fight against AIDS. Tell us, what do you want people to focus on over the next 3 days? What are the highlights? The
highlights is that we've been all impacted by the COVID pandemic. And the fight against AIDS has also been really heavily impacted. And we cannot let those progress that we've been making for the last 3 decades at least being set back further. So we need the support, we need the funds to be able to push forward with the different research programs and also supports to people living and exposed with HIV.
All right, Cédric Brucklandé, thank you very much indeed.
Thank you.